Good morning and welcome everyone. My name is Bruce Satindi. I am from Rwanda. I'm currently located in Kigali. And it's a pleasure to be here with you all to discuss the Global Gag Rule. The Global Gag Rule was reenacted by President Donald Trump, former President of the United States, when he assumed the US presidency. And the Global Gag Rule, just to remind everyone, prohibits foreign non-government organizations who receive U.S. global health assistance from providing legal abortion services or referrals, while also bearing advocacy for abortion law reform, and even if it's done with the NGOs' own funds. And therefore, the policy allowed access to abortion only in cases of rape, incest, or when a woman's life is at risk. And since the Biden presidency, the global gag rule has been repealed, and that is really what we're here part of what we're here to discuss today. We're here to gain an understanding of the impact of the gag rule on access to sexual and reproductive health and rights for young people in Africa. And we are here to explore the ways in which SRHR, or sexual health and rights, can be funded from an Afrocentric perspective. And lastly, we are here to share ideas. And before I move on to the questions we've prepared for you all here today to discuss and reflect upon, I'd like to take this time to introduce our panelists for today. Um, First up is Raisa Gazu. Raisa Gazu is the co-founder and general secretary of Grow Up Smart organization. Raisa is passionate about the formation of a new Africa where all children are educated on a continental level, where women are given the same opportunities and compensation as their male counterparts, and where the continent is a safe and open environment to discuss sexual reproductive health for citizens of all ages and backgrounds. Welcome, Raisa Gaju from Kigali, Rwanda. Next up, we have Kasozi Umar. Kasozi Umar is an SRHR trainer with more than 4 years' experience of working with young people and men in scaling up the uptake and understanding of sexual reproductive health commodities and rights. Kasozi has worked as a consultant with different organizations where he has trained and helped community leaders to understand gender and sexuality. These leaders are now SRHR champions, and they are now playing a big role in curbing the different forms of violence that come with a lack of knowledge and exposure to gender and sexuality. Welcome, Mr. Kasozi Umar from Uganda. Next, we have Cliver Mwandinji. Cliver believes a few of the promises made in Nairobi during ICPD 25 are yet to be fulfilled in Namibia. These unmet promises range from achieving a low to zero unwanted teenage pregnancy rates, youth involvement in policy making, and condom education. The above mentioned in the view of AfriYan stem from the high teenage pregnancy rates in Namibia, which disables a country from achieving its demographic dividend and yield vast challenges for young people in becoming successful and capable individuals who can contribute to the development of the country. Thank you and welcome, Cliver Mwandindi from Namibia. Last but not least, we have Nora Nakagera. Nora Nakagera is a women's rights activist who is committed to advocating and promoting the sexual reproductive health rights of adolescents and young people. She strongly advocates for gender equality, women's rights, quality and affordable health care for young girls and women, and meaningful participation of young people in national development processes. Currently, Nora is the advocacy and campaigns officer at the Uganda Youth and Adolescent Health Forum, which is a youth-led and youth-serving health and human rights organization that seeks to advance and promote quality and improved health and well-being of young people. She works closely with adolescents and young people living in hard-to-reach areas, living in extreme poverty, and from minority groups. Nora's ultimate goal is to create a grassroots movement that understands, values human rights, and takes responsibility for respecting, defending, and promoting human rights. Thank you very much, Nora, and welcome. Um, Thank you all for bearing ears and for being attentive. And now, as we move on, I would like to introduce the questions that we have prepared here today. And please feel free to drop your messages in the chat as we go on, and uh, I shall call upon you once the question time has arrived. Welcome, Mudashin Shkwa. Welcome. So the first question goes to our first panelist, Raisa Gaju from Grow Up Smart organization. As an SRHR advocate, how has the enactment of the gag rule affected sexual reproductive health and rights in your country? Raisa, the floor is yours.
Thank you, Bruce, and thank you everyone for attending. So I think my answer to this question is an SRHR advocate. I think that the enactment of the gag rule has affected the sexual reproductive health and rights in our country in different ways. Number one is that a lot of NGOs, in one way or another, receive funding from the US government. So with the enactment of the gag rule, this limits what NGOs can do in providing SRHR services to people who need them. For example, a study done by one NGO in our country last year is that in the first half, so January to June, in the first half of 2020, there was 17,000 girls, teenage girls, who needed an abortion. So just a little background information, in Rwanda, we have a criteria where you can only get abortions. They're only legal if you fit in 5 criteria, which is rape, incest, you're underage, it is causing harm to you or the baby, and okay, the last one is kind of passing my mind, but those are the only ones that you have to fit into the criteria to be able to get an abortion. So with the enactment of the gag rule, NGOs are limited in which services they can give in the SRHR department, which are things abortions. They can't give advice or counseling about SRH, anything relating to abortions, which also includes contraceptives. So I think that it has affected the country in general, because we see that a lot of victims will fall to the lack of knowledge, and they end up being pregnant, which increases the number of teenage pregnancies, which increases the number of illegal abortions. And it's just a lot of people are stuck in the crossfire of that. So I think the enactment of the gag rule has affected definitely has had a social impact on the country, and on a lot of girls and a lot of young people, even men as well, because they're not given the information that they need, and which when we see the number of teenage pregnancies rising, the number of illegal abortions, the number of a lot emergency surgeries, people going to the emergency room because of not having information about certain topics, because a lot of NGOs that are supposed to be providing these services so that those people are beneficiaries are not giving this information because of the enactment of the gag rule. Thank you.
Thank you so much for your insight, Raisa. Indeed, I like that you touched upon the teenage pregnancy rates that have surged in Rwanda in the very first months of the COVID-19 pandemic. And you spoke about how comprehensive sex education has been limited, and the accessibility of contraceptives or information about sexual activities. Thank you very much. And I will move on to the next question. I will leave some time at the end for all the panelists to reflect on all the questions. But moving on to the next question. The next question reads, what are the limitations of the gag rule in terms of allocating resources to those who need it? And this question would go to Kasozi Umar. Mr. Umar from Uganda, please share with us your insight. Mr. Umar from Uganda, please share your insight.
Yes, thank you. Thank you so much. I just want to bring to your attention that in Uganda, in Africa, some socialization being done, the African Citizens Initiative and a Parenthood Foundation, where member country organizational representation control process to facilitate the SHR work. Uganda being represented by reproductive Uganda, but we should also know that countries organizations should be encouraged to re-engaging the different stakeholders, because you don't have to put a focus only to funds. It will make our work in the SHR world unsustainable. So we should look at avenues like this avenue, the Citizens Initiative, where local organizations, in case they have funds, they have to contribute to a common pool to be prepared for instances where funding is low or where there are restrictions. Our countries on providing care, increase the budget. In Uganda, our current budget is around 2.5 million shillings. But to put a lot of, as this budget is increased, we should put a lot of emphasis on see that this budget is passed. But what is the concern on access and utilization of SRR services? Are the health workers capacity to handle these issues? Because it's a different issue for you to access services and getting to a person who is well versed with the services you're asking for. Because in the communities where we've been working, we've realized that even some health workers still think that abortion is illegal in all forms. The first panelist talked about the types of abortions that are allowed in their countries, but in some cases, these don't even know that the abortions are allowed in cases. These are restrictions that we have in our countries. Abortion is allowed in cases of rape, incest, and in case a woman's life is in danger. So we need to to strengthen the capacities of these workers and make sure that they are well positioned to give the services to. Another thing I would add would be on government familiarizing these workers with even us non-governmental organizations, familiarizing health workers with the new policies and frameworks that are in play that are guiding us in our current work of SRHR. These workers haven't updated, and we have to be as advocates, because if we want our issues to be addressed in a wholesome manner, to be catered for, we need to take an extra mile and go into the city, train these workers on the new findings and policies that we are basing on in our work. So I think I'll submit on that. Thank you, bro.
Awesome. Thank you so much. Thank you. I want to open up the question to other panelists as well. If you have anything to say, now is your time. If not, we'll just go ahead and move on. Okay, so let's go to the third question. And we are a bit skimming through these, and so I will take some time for everyone to reflect on all 5 questions. But the third question speaks to where does funding come from, if not from the major stakeholders such as the United States? And how can African governments become more self-governing on providing quality sexual reproductive health care and creating sustainable healthcare systems? In this question, I'd like to address it to Claver from Namibia. And if you'd like to please reflect on the first 2 questions, please use this time to kind of speak about what are the effects of the enactment of the Gag Rule that you've seen in Namibia. What are the limitations in terms of allocating resources to those who need it? And indeed putting it all also back into perspective on how can African governments or our own local healthcare systems be more sustainably effective. Please, Claver, the floor is yours.
Thank you very much, Bruce, and good morning, everybody. It's morning here in Namibia. I think maybe I can reflect to what are the limitations of the gag rule in terms of allocating resources to those who need in the country. I would like, for instance, to say human organ and trafficking organizations benefit from this rather to, and may benefit from this from a lack of necessary services, which force young people to resort to illegal means like illegal abortion or unsafe abortion in order to get access to services. And because of the absence of safe abortion services, this leads young people, especially girls and women, to fall prey to sexual trafficking or organ trafficking through accessing of black market services that are branded as safe, or moreover, the lack of comprehensive sexuality education or comprehensive sexual reproductive health services, which leads young people to fall prey to also to sex human traffickers as they seek to travel to other countries that have comprehensive sexuality education services or comprehensive SRHR services that are available for young people. I think for me, that's my reflection to that. I don't want to elaborate to go deeper into it. Going into what was my question again? The funding, going into the funding of SRHR services within Africa without the involvement and the or the dependency on the U.S. government. First of all, I'd like to say I think Africa at large at the moment has been made up of bodies, governing bodies, and these bodies are there to coordinate African countries and African governments to work together in order to build an Africa that is self-sufficient, an Africa that is independent, an Africa that is self-productive, an Africa that is united, an Africa that depends on itself, that works together to achieve a common goal. And these bodies, to make an example, are bodies like the AU, for instance, the SADC government, or the ESA commitment, which most of the countries are a part of, that actually advocates for meaningful youth participation and sexual reproductive health rights. These are the bodies that obviously can enhance the improvement or the development when it comes to providing funds or making funds available sexual reproductive health rights. Funding for sexual reproductive health rights within Africa context already comes from various streams of various streams, including multiple international donors. Obviously, that's what we are sitting with. Agencies such as EVOS. EVOS is these are African based organizations, Global Fund, and obviously, as we speak at the moment, we know that UNFPA, UNAIDS, and other various UN organizations are part of this. But like I said, this funding is also contributed by various individuals. Governments, African governments need to increase a sufficient amount of their annual GDP. That is one thing that we have to look at. Funding towards healthcare to ensure the significant portion of healthcare funding in unmarked for or that is earmarked, for fundings. So again, like I said, putting in proper coordination and proper governance in Africa, Africa at large is capable, or it's in their capacity to be able to make funds available for programs like SRHR services and other programs targeting universal healthcare, which only speaks to Africans. So for now, let me leave it there. Bruce. Thank you.
Yes, Bruce.
Yes. Yes, Kasozi.
Yes, kindly allow me to take you back to a question of limitations.
Absolutely, please.
Allowed? Thank you. I want to talk about the restricted advocacy that we've been facing in this country. Yesterday, I had the executive director of the Golden Rights in Uganda.
Mr. Omar, may I just say, you're breaking up with your microphone just a little bit, if you can regulate it.
Sorry. Yesterday, a conversation with the director of Rwanda, a woman and a organization. She shared with me how hard it was for them to talk about abortion services during the Trump administration due to the fear of losing their funding. This the advocacy around abortion accessibility those who need the services. I want to bring it up that in Uganda, a combination of abortion pills is around $13 to $22. And for the surgical, you need to have around $22 to $81. Not many sex workers and other adults and girls and young women can afford that. So this brings me to this thing whereby the NGO affiliated clinics like Marriage Stops, Naguru Teenage Center, and Productive Health Uganda here in Uganda that offer abortion and post-care abortion services only operate with the availability of funding. So the gang rule limited the provision of services to these people who need these services in a way that they couldn't get these services in times of need. So, but we're really positive and very happy to see that it was repealed, and we're looking forward to greater things to come. Thank you so much for the time, Bruce.
Yes, thank you so
much. Bruce, sorry, I just wanted to comment on the third question.
Yes, please.
Yes, I've forgotten the previous speaker's name, pardon me, but I will just say, apart from the U.S. government, there are still other countries or donors that can support us when it comes to sexual reproductive health work. For example, I know in Uganda, most of the big grants that are around sexual reproductive health are coming from either the Netherlands, Norway, Sweden, Canada, Germany, and the UK. So maybe we can also sensitize fellow organizations to start looking at these donors for funding other than the UK. And then I think it had a part B, what governments can do so that they do not overly rely on foreign money. For example, Uganda, we can use upcoming days or advocacy days or global moment days to fundraise, like it was for the She Decides conference that was held in 2017. They used the conference to talk about the Global Gag Rule, but also find ways of fundraising for resources. And I will say for myself, for example, UAF is leading on the She Decides local movement in Uganda. And it wouldn't have been possible if they hadn't thought of creative ways of finding finances to help out. Then also governments, I think my colleague Omar had stated that African governments need to prioritize health in their budget so that they do not have to keep looking out for donors to help them with their health needs. For example, in Uganda, I think they're planning to cut our health budget even after the repercussions of COVID. So I think we need to set our priorities right. And then also, I know most of the African countries are looking at having universal health care. So we need to see how we integrate sexual reproductive care into the universal health care packages that we are developing. That way, it will help us address the gaps that we face during the Global Gag Rule phase. Thank you.
Thank you so much, Nora, for your great insight. And as well, thank you, Omar, for bringing us back to the question of the limitations. And I'd like to go back there for just a little bit, but let's finish with this question about where does funding come from, if not from major stakeholders. And as Nora mentioned, including European countries such as Germany and more. I do want to. Someone wants. I do want to maybe since we're talking about youth and Mr. Boy.
Anything.
Since we are talking about the youth, and since we're talking about the youth in Africa, and how the gag rule has affected the youth, specifically the youth, and what our insight is, how can the youth aid in building sustainable healthcare systems? For example, with the aid of governments. And I'll give this question to someone who hasn't. I see Moses Okoth raised his hand. And you know what? I'll just go ahead and allow that for now. Why not? And after Moses, please, we can give the floor to the panelists to continue. Moses, you may speak.
Okay. I'm not sure whether you can hear me.
Yes, we can hear you. Yes, we can hear you, Moses.
I'm trying to state this. Part of the reason why we are where we are right now is because we have just become kind of living in this bubble where we do believe that Western countries are the only solution to our problems. I do believe in the saying that homegrown problems, homegrown solutions. We're not at that level where we want to be able to say we have our own solutions to our problems. So every single time when something comes about, we have to say that the Western countries have got to be able to give us the funding for this. They have to direct how we run our things, which really puts us to that situation where even with young people over the years, we every single time looking at funding from other places. We don't want to get to our own solutions to our own problems. I agree that part of the reasons why we have a lot of projects which get funding from Western culture is because we've grown up to know that this is the way it has got to go. We don't want to use our local resources. We don't want to use our local solutions. That leads to us being kind of NGOized, we are so much focused on getting this money from the US that the ones who are going to give us this, and that's the reason why you get to that level where they're able to control whatever you're doing. You're stuck in this situation where you're between a rock and a hard place. If I don't do this, they're not going to give me the funding. That needs to actually change.
Thank you so much for your input, Moses. I see you've written a couple of things on the comment section, and we'll definitely get back to your comments. And let's clarify and see that indeed the gag rule has been repealed, and now what we do, even this is an additional source of aid and of mobilization. And indeed, we need to be more proactive on achieving the results we desire. And I see there was a comment up here. To get to this, there's a comment up here that said the limitation we have on the gag rule in terms of the allocation of resources to those who need it in the country is mainly in terms of the donors conditionally. And so perhaps that was an answer to this question that gave a little bit insight onto the requirements in meeting the criteria for certain donations. Now, is there anyone on the panel that would like to comment further on this question? If not, well, if not, we can move on to the next question. And indeed, you can always refer back to it as you would like. The fourth question, let's take it back also to the comment that Nora made about the She Decides conference that happened and so the question reads, as you can see, how do we localize the feminist movement, the gender equality and equity movement into the context and language of our communities? To that question, I would like to give that question to Nora. Why would you begin? Would you begin with us?
Yes, I can. I think I will, like I said, for example, as Uganda Youth and Adolescent Health Forum, we are part of the She Decides movement, and there are those days that we celebrate as partners or activists that belong to the She Decides movement, and one of those days is the She Decides festival that is held on 2nd March annually. So with these festivals or gatherings, we usually discuss about the challenges that we face while we are trying to provide sexual reproductive health information and services. We share experiences with the various countries. And it's not only limited to the countries in Africa, but even those outside Africa. So it helps us, one, forge solutions to some of the challenges that we may have, but also it makes us think outside the box without having to rely on donor influence. And then also the local movements usually help you find local solutions to the problems that you have. So for example, before we were all looking at the She Decides global strategy, but we did realize that there's some of those issues that they're fighting for or that they're facing, and then that is not the story with us. So last year we came up with our She Decides strategy that is going to help us advocate for sexual reproductive health rights. But then also amidst the Global Gag Rule, we also had a win as people that are advocating for sexual reproductive health. And that came from Argentina. We all know that towards the end of last year, they did legalize abortion. And we all know it's a very restrictive environment in there, but with this, it made us realize that one of the ways that made them have this win is because of the feminist approach that they were using as they were advocating for having an end to the restrictive laws that they had put around abortion. So for me, I believe, one, we can learn from one another, but also try advocating for sexual reproductive health looking at a feminist lens, because the patriarchy system has taught us that as women, we cannot decide what we want to do with our bodies. And also the patriarchy system looks at abortion as moral decay, but also they link it to religious and cultural beliefs that are strongly embedded in us as Africans. Yes, I think that is what I can say for now.
Thank you so much for that great insight. And perhaps for those, I just want to have a little bit of conversation with you. for those who have not had the pleasure to participate in the She Decides movement and the events that surround the area, how do you think those can be replicated across the continent? And what do you think are the solutions that you spoke about and that you devised in those conversations that perhaps we can use in terms of maximizing the repeal of the gag rule, if that makes my question makes sense.
I'm sorry, Bruce, there was an echo. I couldn't really get your question.
Yes, I was asking, sharing your experience from the She Decides movement and the events and the conversations that surrounded that time. How can the solutions that you or the conversations that you came up with be aligned with the conversation that we're having today?
Yes, thank you. I think one, we can align these conversations by reaching out to the grassroots people, but also try to use the bottom-up approach. I think that one of the biggest disadvantages that we had, and I'm speaking as Uganda, is most of the times we look at the policy makers and then forget the people that are being affected by the gag rule. So through the interactions that we had, we realized that there's a need to go to the grassroots people, tell them what their sexual reproductive rights are, what do they know about this global gag rule. And it's interesting, there are some of the grassroots organizations that had actually stopped carrying out certain services like family planning because they did not quite understand the terms and conditions for the global gag rule. So having these conversations with them made them realize what the global gag rule was about, but also how they can continue reaching out to the women and adolescents that need these sexual reproductive health services. And then secondly, there's also, and I will use this as an example, even us ourselves, we were curtailed in so many ways because of the global gag rule. There were certain things that we couldn't do because you're thinking of this USAID fund that you have and then the work that you need to do. So we found innovative ways of passing on the services, but also the information. I think because of the gag rule, we were forced in a good way to open up an adolescent health clinic that is not funded by any donor, but rather us locally. It's a local initiative. And we all know what happened during COVID. That needed support for both family planning issues, post-abortion care, name it. And we were also able to, of course, with their consent, to document the girls that had carried out unsafe abortions. And we are going to use this documentary to raise awareness, but also advocate for the restrictiveness around the law, but also have evidence and data on what the gag rule was able to do. A small percentage of some of the girls and women that were able to reach. So with those that are not part of the She Decides movement, I think evidence building and having data is really, really a very strong key that we can use in our advocacy, but also sensitization.
Beautiful. Thank you so much. Definitely writing that down, evidence building, research and data. And congratulations indeed on building the clinic. And good news that the gag rule has been repealed, and so definitely there is more room to fund that project and to fund the access to resources to exactly the grassroots beneficiaries that we're talking about. If we are going back to reflect to what Raisa has mentioned, in Rwanda, the 17,000 girls that needed pregnancy-related care or sexual reproductive health care from January until June alone is evidence enough that the movement, the feminist movement, and the gender equality and equity movement is interrelated with maximizing this repeal of the gag rule. Now, Claver from Namibia, Mr. Mwandinji, would you have something to add on to the question? I see two hands raised. Kasozi, Mr. Omar, would you like to speak?
Yes.
Yes.
Yes. Has mentioned. Also, we called the Reserve Foundation, and for a while now,
sorry, please stay right there. Please stay right there. We can hear you perfectly where you are. No.
So I've been doing some great work as a professional on how best can scale up and engage men and boys in our communities that we achieve dignity and we live harmoniously as all genders in our community. But there is this that I want to bring to our attention, the patriarchal nature of our societies. Appreciate as adults, we need to go on with this work of ours and for communities that we live, where we do our from, that they have shared the role of women in the social and economic development of our community. So as we get them on how they can afford them, let us also know the adults and young women. Let us men take up and use them to air out their issues and hopefully the solution for their issues. Gender equality and equity can be achieved if all the necessary stakeholders pledge to support the movement. How about let cultural leaders come out and amplify the voice on how best we can out? Let show the communities. Yes, it's very good to educate a girl child. Let the religious leaders come out and have their followers understand that having manageable families is economically important. Let the government continue with designing and implementing programs that financially. When a woman is financially empowered, she will have stake in her goings or in the goings of her family. But women have no stake, and we can't women empowered financially. Something should go back to this patriarchal nature of our society. Why don't you start between your pregnancy? She will tell you, my husband is not okay with that. My husband allow me to take family planning. So as we do that, let's also continue our women and our sisters. That beating them isn't love, isn't a sign of, So such empowerment, such trainings, that these movements are going to be strengthened, so that it doesn't act on the international level, but it means existing in the societies, because that's where real impact is. We come here at the international level, but if these people are not empowered, these people in society, these women in the society, these men in the society, these boys are not empowered, are not how best they can handle the girl, depending on how best they can handle the. I was just going to stop lamenting. So let us go back, let us go back to the society, let us take these programs in the society, let us empower the girl child, and let's continue educating. They have a big role. Thank you so much, Bruce.
Thank you, Mr. Omar. Wonderful answer. Now, anyone else on the panelist wishing to speak, I will open the floor up to Raisa, who hasn't spoken in a while, Ms. Kaju from Kigali. All right. See, she may. Hello, Raisa, can you hear us? All right. I think let's move on.
I'm sorry, had cut off. I can hear you.
Wonderful. How would you answer this question on how do we localize the feminist movement, the gender equality and equity movement into the context and language of our own communities?
Okay, this is a really good question. So I think that we can localize the feminist movement within the activities and actions of our communities. For example, I think around Rwanda is known for its weaving, so weaving baskets, things like to like decorative items in the household, things like that. So I think that to localize the feminist movement in gender equality and gender equity movement is empowering women to be like to soar higher in the fields that they're good at. So not just limited to weaving baskets, not just limited to not just limited to a certain field, but to help them soar higher in the things that they're good at. So if it's in the context of Rwanda, it could be weaving baskets, it could be in the coffee fields, it could be in the parliament. So I think we can localize it by empowering women where they are in situations that they're already a part of, and they're already doing on the daily, and encouraging them to soar higher and go above and beyond in their field. Thank you.
Thank you so much. Thank you, Raisa. Um, Thank you, everyone, for being so active and for participating insightfully in this conversation concerning the Global Gag Rule and its repeal by the Biden presidency. Now, I'd like to move on to the last question, and then we'll reflect in summary all together. And this question reads: what is the roadmap to maximizing the benefits of the repeal of the gag rule? We've definitely mentioned a couple of subjects that I would like to touch upon on this question, be it advocacy for policy change, be it engaging cultural and religious institutions in the dismantling of patriarchic systems or systems of sexual oppression, and indeed talking about how can we mobilize resources at a greater level, even using this available opportunity of that it has been opened up by the repeal of the gag rule. And so the first person that I would like to answer this question, Mr. Cliver from Namibia, would you please answer what is the roadmap to maximizing the benefits of the repeal of the gag rule?
First of all, yeah, I had so many other comments to make on the other questions, but let me tackle this one first. When it comes to expectations, first of all, I hope you can hear me. With the accession of the new U.S. government, it is and its expectations amongst the NGOs community that democratic government would repeal and reverse the global gag rule policies or in the Donald Trump administration. I would first maybe like to say at the beginning of the term of the new president now, which is Joe Biden, he repealed that the global gag rule of the Trump administration, restoring funding for women, reproductive health services, and rotating funding to UNFPA, which is one of the UN agencies, and this has increased expectation as other US agencies are yet to follow with the increasing and funding. And when it comes to advocacy for policy reform, the action by the US government has provided an opportunity already for NGOs to advocate in policy reforms, engaging cultural and religious institutions to do away with norms and stigma. The development of or the new development of the new developments at the moment right now are great opportunities for the global NGO communities to continue advocacy for CSE and comprehensive sexuality education within countries, and to ensure a constant provision of services and continue education or community mobilization or community education, and mobilize the increase of uptake and the increase of SRHR services and comprehensive sexuality education. So coming to that, I think engaging in rather the, or say, talking about the new roadmap, we must first of all form a coalition in regards to coordination, where everybody, whether it's U.S. agencies or NGOs and governments, work in collaboration in order to look at an increase of uptake of comprehensive sexuality education and SRHR services. I think for my side, that's what I would like to say first. But I wanted to comment on some of the questions that we had spoken about earlier, especially when it comes to localizing um, uh, the localizing of gender equality and inequity that we were talking about earlier. For example, we have to understand that the movement of feminists and gender equality and equity, those are movements that have been existing already. It's not something new that we are talking about. It's not new in the African context. They have been at the forefront of liberation movements. We had women already during the liberation movement who had been engaging in the fight for women in leadership, and had been engaging in the fight of gender equality, even though it was not regarded or linked as a feminist movement. But it was, obviously, we had movement in the emancipation of women in fight against apartheid already in the past. And these are the stories that we must, at the moment, document looking forward to what has been done already. I want to make an example. For example, in Namibia, we had a protest, a Shut It All Down protest last year, which literally has knocked a lot of, or raised a lot of eyebrows of not only neighboring governments, but also within our own government, where the young people literally took a stand and face the justice system, face the system, or face policymakers to say, look, we are tired of what is happening. We are tired of how the justice system is enabling, for example, issues around gender-based violence, whereby perpetrators are not really dealt with. We are tired, and from the male side, you could see the young people are saying, we are tired of the system that is enabling gender-based violence. And this came after the time where a lot of young men and were tired of falling under the shaming name of men are trash. And uh, uh, the the youth was saying that it's not men that are trash, it's the system that has been broken. Because today we have a system that has classified men as trash because men are the main or the majority or primary perpetrator when it comes to gender-based violence. But we are forgetting that this very same man that has grown up as a boy in a system that is broken. So I believe, for me, it's systems that need to be revised. For example, we need to bring women in the systems. We need to bring women to inform the systems that are guiding, or that men are raised up, men are raised in, even women are raised in. I think we have to sort of advocate for a meaningful participation when it comes to legislation and policy making, and literally meaningfully involve women when it comes to this legislation and the system. What kind of system are we dealing with? What kind of system do we have in our government? Is this system enabling? Is this system addressing the issues that we are going through, that communities are going through today? When it comes, for example, in Namibia, at the moment, we are sitting with customary law and constitutional law. Where does the customary law come? Where does it stop? Where does it draw its line? Where does the constitutional law come in? And where does it draw its line? How do we meet each other and address even the issues of harmful societal norms, harmful traditional and cultural norms that at the moment are sort of the drivers of gender-based violence or gender inequality and inequity. So I think for me, it's looking together to stand and advocate for the revising or the changing of the system, of unpacking these systems and literally looking at how, as a young person growing up in the community, what type of system am I growing up in? What type of system am I learning from? What type of system am I being part of? I think those are some of the things that we can look at in order to localize and also to address gender issues or the gender imbalance. Another thing I wanted to add on to, sorry, Bruce, I'm gonna be saying a few things now for a while. When it comes to, apologies for the background noise in my background. When it comes to limitations of funds, I think we also need to advocate for, especially NGOs and civil society organizations that are within the country. We need to come to a stand with our governments where we advocate for funding partners, whether it's US based funding partners, whether it's the Western countries that we are reflecting to, saying that instead of looking at US government, we can look at other countries like Germany and Swedish. But still, we need to bring these countries or these funders or these development partners to understand what we are dealing with in our countries in regards to what does our development plan say within our country? What do we want to address at the ground level, at the grassroots level? What are our communities facing? For example, if a development partner is coming in with the funding that's targeting PrEP, does our government really need PrEP? Does our community really need PrEP? Or do we probably need to be sensitized on other issues like maybe condom use and promotion, or maybe how we can get into and bring safe abortion to the table? Is it really PrEP that we need in regards to, because PrEP again, it's prevention of sexual transmitted diseases, but then it's not prevention of teenage pregnancy. And at the moment, it's one thing I've seen in Namibia, which at the moment has raised a lot of eyebrows, especially among young people, where we had governments or funding partners coming in and really pumping funds into PrEP. But at the moment, right now, I think we are one of the countries after the lockdown of last year that is sitting with a very, very high increase in teenage pregnancy. And this, you can already see that we haven't really studied what is really happening in the community. We haven't really addressed the root cause. Is it really sexual transmitted diseases? Yes, we do want to stop that, but we haven't stopped teenage pregnancy. And at the moment, we have more than 3,600 adolescent girls that are dropping out of school, that are not going back to school in the year 2021. So that's also another way of saying we have failed because we did not sit down with the development partners to say, this is what we want to address, this is where we want to go, and this is what we are facing within our community, and these are the issues that we want to address. And that should be brought up from the grassroots level, from the implementer to the legislation maker or the policy maker, which is the government. Sorry, Bruce, I had so much to say, but thank you very much for the floor.
No need to be sorry at all. I greatly, deeply, and humbly appreciate your insight. We all learned such great information from what you've shared. And indeed, as we kind of create a bullet list to answer the question of what is the roadmap, we definitely spoke about designing research accumulation strategies for data and evidence building, even as Nora said, and actually recognizing where these resources need to be allocated to in correlation with the needs of the people. And it was wonderful to hear about the Shut It All Down movement that we all had the pleasure to witness last year, and indeed created the momentum to which we are in this conversation here today about. And indeed, I like the point about advocating for funding partners and actually creating sustainable partnerships that are grounded in achieving the best results. Mr. Moses Okoth raised his hand, and I would like to, Mr. Okoth, please share your insight, please.
Yeah, I just wanted to like finish up with the last part of our question, which is the roadmap to maximizing the benefits and the repeal of the gag rule. And two things we must realize. One is we didn't really cover this much is because of what is happening with C19. If you look at what the panelists have said and most of participants have said, is that we do realize that there are a lot of issues happening with women right now. There's a lot of violence happening with women, unwanted pregnancies, a lot of school dropouts. This is because of, there was that before COVID, but COVID has just made sure that this is now coming out in a very, very different way. If you look at what happens during the International Women's Day, a lot is coming out in terms of what was not seen before C19. We need to address the fact that women have got a very, very vital role to play in this gag rule, in that the voices are now coming out and they're one of those people who the voices need to be given, and we have to like really stand behind them as men and make them be seen rather than men just being seen out there. And secondly, I will speak from the point of view as a Kenyan. I don't know what other nations are doing, but my government is responsible for making sure that we can be able to like make sure that whatever has been repealed can be put into place rather than just keep quiet and watch it go along as it is going. I'm sure we have seen what is going on in terms of, if you look at the news today and you open up your news, and the newscaster starts with "Good evening, viewers," and then he say, and there is nothing really good about the news throughout. You like, everywhere in the world is like on the edge. Everyone is on the edge. So you're like, why would you say good evening when everything is basically messed up? But having looked at that in a very different way, I'm sure that with networking and with C19 having to come to the forefront, there is power in networking the way we have right now. We really need to like harness going on with a conversation like this and keep on speaking to each other and trying to like give voices to our young people and women and our leaders and telling them that this needs to happen. I would like to say that this has been a very fruitful conversation and it needs to go on rather than just stopping it here. I think I'll end it at that.
Thank you for your avid participation, Mr. Okoth. And I want to extend this question again to some of our panelists. Please reflect on what both Clavier and Moses have said. I'd like to send the question to Raisa Gaju. Would you please share with us your insight on what is the roadmap to maximizing the benefits of the repeal of the gag rule?
I think that I think in order to maximize the benefits of the repeal of the gag rule is that in this time that we're given, so in the next 4 years, I'd say, we give time for NGOs to invest time in the platform of SRHR, in the sense of, I think this is the time to start from the education basis of going and giving information to their beneficiaries, giving them things to help that will help them, even if the gag rule is brought up again. So I think that the basis of everything is education. So if you're giving people education in SRHR services, if you're giving them information about contraception, you're not only equipping them for now, but you're also equipping them for the future. So it's the saying: if you give a man a fish, you'll feed them for the night. But if you teach them how to fish, you're feeding them for a lifetime. So I think it's time to invest in the education of SRHR services.
Awesome, thank you. Investment in the education of SRHR services, and following on to the points that Mr. Okoth also said about achieving, about continuing the conversation and continuing the action that surrounds the conversation. And I think Rice's perspective also said about the conversation. And I think
Good. Sorry, colleagues. It looks like we lost our moderator there for a second. We're trying to get him back on the call. We thank you so much for staying tuned. He's gonna log in shortly. I think if there are any questions or comments, I think let's take, we will open the floor for any questions and comments, and we will direct them to our panelist while we try to get the moderator back. So colleagues, feel free to, raise your hand if there's any question or any comment.
Yes, thank you so much. I just wanted to comment on the roadmap to maximizing the benefits of the repeal of the gag rule. One thing I think we should start with right now is working on the perceptions of young people and health workers around abortion. As I commented earlier, most of them still think that abortion is legal in all cases, hence opting for unsafe methods of abortion that bring about complications like fistula and increase in maternal death. So, as advocates, we need to scale up our efforts in advocating for policy change. Like policy change on the existing restrictions in our country, because in most of our countries, despite the fact that the gang rule was in place, but even there are restrictions that make our advocacy work a bit tricky. So let us continue with advocating for policy change. In the case of Uganda, our laws are very confusing because the Penal Code Act says abortion is permitted in order to save. In instances where a woman's life has to be saved, or in cases of rape, in cases of incest. But that same law goes ahead to say that clients who have abortions and healthcare providers who perform abortion are at a risk of over 14 years of imprisonment. So we still have a lot. Since the gag rule has been repealed, let us use this space to advocate for policy change to see that we have an effective and conducive environment to do our work and advocacy, because our work is governed by these laws and policies. So if they are not favorable to us, our work will be, will be tampered with. So one thing I'm pushing for, like to us young advocates in the SRHR community, let us push for these reforms. Like for now, let us resume our comprehensive SRHR advocacy at all levels, since the rule, let us resume our comprehensive SRHR advocacy at all levels, since the gag rule has been repealed, and create more demand creation. Let us give these young people options. We all know that we love options. Young people need to be in a society where he has an opportunity to choose from a variety of things. And our SRHR compact has all those things. So with our continued advocacy and comprehensive education to these young people, adults and girls and young women, we'll give them the options they need, so that if he or she can't use a condom, she can opt for another method of family planning. In case she gets a pregnancy that is unwanted, she can opt for a safer method of abortion. Not doing these things they do of taking tea leaves, and they get complications that are not even that cannot even be revoked or cannot be put back. So that's one thing I wanted to pass out to my fellow advocates and young people on this call. Thank you so much.
Thank you, Kazi, for the contribution.
Can I give a contribution quickly?
Yes,
because I'm about to lose network now, and I just wanted to give a contribution.
Yes.
My overall contribution. I think from my side, and I would like to first of all thank also the Stronger Justice and everybody else for this very informative and resourceful panel discussion that I've been a part of. I learned a lot today, but I want to stress on the issue of meaningful youth participation. I think that is where we are failing, especially in Africa. When it comes to meaningful, we need to understand the term meaningful youth participation. What is it really? What do we really mean when we are talking about meaningful youth participation? And what do we want to do? Where do we want to go with meaningful youth participation? And I believe that that's where a lot of governments are failing. That's where a lot of NGOs are failing. That's where a lot of partners are failing. That's where even we ourselves are failing, because meaningful youth participation does not mean bringing young people to the table to come and rubber stamp, or to come and endorse, or to come and be part of a conference, and they were part of the coffee, and you have exchanged words with them on their ideas, but then you do not make the ideas to be part of whatever document, whatever planning that is being done at that table. So I think taking in mind that majority of the population of countries in Africa is made up of young people, we really need to stress and give meaning, authentic meaning, and authentic participation when it comes to meaningful, or involvement when it comes to meaningful youth participation, where we are allowing young people to be drivers, not only to be at the table and consult on documents, but to be drivers when it comes to implementation, to be drivers when it comes to data mapping, to be drivers when it comes to resource mobilization, to be drivers when it comes to collecting data, or monitoring and evaluation. I think this is what we must strengthen within our organizations, within our governments, and in everything else that we do. We must really look at what meaningful youth participation is. And I'm saying this because in my country, a lot of things have started. I'm one of the young people actually that was appointed to drive the national condom campaign. And I'm not saying this because of me, but because of the young people that I've been working with in the last 3 years, that we have been driving the condom promotion and education in our country, in Namibia. In these 3 years, we have distributed and educated more young people compared to the last 6 years that the government has been using your cultural methods of distribution and education. So that only proves to the government what it means when you allow young people to drive agendas, to drive implementation. And also, let's not misunderstand that young people do not want to take over responsibilities, or to take elders out of responsibilities. Yes, we do want to learn, because I believe as a young person, if I'm coming into a position, I want to be working alongside an elder to learn from that elder person on how things are done. But also then I want to be given room to be able to execute, and to be able to contribute on when it comes to innovative and the language that we speak as young people as well. So in short, what I want to say in everything that we are doing, whether it's from a government level or an NGO level, and from the level where we are now, I think we must really give meaning. And when we talk about meaningful youth participation, we must mean it by allowing young people to drive. Thank you very much.
Thank you so much. It has been a pleasure having you here today. And thank you, Josephine, for taking over while I was away. Thank you so much. I cannot express how sincerely grateful I am for your insight. Indeed, for young people to be the drivers of implementation, of policy design, of resource mobilization, and really uncovering what it means and what it looks like to create effective organizations, and to really pass on the baton for leadership. Now, I would like to pass a question to Nora. I believe she is the person who hasn't answered this question, if I'm correct. Nora, the floor is yours.
Yes, thank you very much, Bruce. For me, I think I'm seeing young people coming up with a lot of innovations. And these innovations are partly because of the effects that were brought about by the COVID-19. And these innovations are also local innovations. For example, like in Uganda, we've had people transporting ARVs to fellow young people that are in hard-to-reach places, or are not in position to move the long distances in order to get these medications. Then we have the telemedicine things that have come up. For example, like us, we were able to come up with the Subi helpline where young people reach out to us either by SMS or phone call, WhatsApp, and then they ask information related to sexual reproductive health or request for services, and we refer them or link them to a nearby pharmacy or health facility that is next to them. Away from the innovations, I also believe governments, local governments need to document the impacts that countries have faced because of this rule. And the reason as to why I say that is because a lot of human rights violations of women and girls have happened because of this rule. And this also became actually worse because of COVID-19. So if we have African leaders, African young people coming together, rallying behind one another to issue out statements about these violations that adolescent women and girls have faced, that will also open up our minds to more funding, but also solutions, but also highlight the negativity of the Global Gag Rule. Maybe with these statements, we could do away with this rule forever. And then I'm also seeing governments prioritizing sexual reproductive health. And this is because I think all countries are suffering with the high rates of teenage pregnancies, unsafe abortions, then increase in HIV infections, STIs. Children are not in school, like in Uganda, I think it's only candidate classes that aren't in school. So governments have realized that sexual reproductive health or health should be prioritized. I'm also seeing more funding outside African continents because we will need to find solutions to the effects that have come up because of the COVID-19. Yes, I think the other submissions were made by the previous panelists. Thank you.
I think we've lost our moderator. Yeah, internet challenges. We apologize for that. I think I would want to open the floor. We are almost concluding the meeting. I would want to open the floor to questions. I see there are many there's conversations happening on the chat box, but I would want to open the floor to to the participants to ask any questions to our panelists if there are any. Or you can make your contributions. So you can just let us know by raising your hand so that we allow you to make your contribution. Thank you.
Yes,
I think Paul had a question earlier on. Paul from Nigeria. He says that I'm interested in knowing the message strategy adopted in the cause of advocacy in the countries where the government accepted abortion as a right of women rather than a moral issue. So to our panelists, if anyone is able to take that question.
Thank you, Josephine. I think I will quickly respond to that because it's me that raised it. Like I said in my submission,
yeah,
they looked at it from an angle of feminism, which addresses patriarchy. So this brought fellow women on board. And we all know in advocacy, when you're using emotional advocacy, especially, you get results. You get your intended results quickly. But also the fact that they went to the grassroots people that are actually suffering from effects of unsafe abortions. And they also highlighted how much Argentina was spending on the provision of post-abortion services to women and girls that had incurred an unsafe abortion. So I know in many situations, people will use the moral and religion, emotional blackmail, if I may say. But if you bring it from that angle, I think that is how they were able to register a success. Yeah.
Thank you so much for that submission. I'm just also trying to check if we have another question, but to our participants, please feel free to, make your comments or contributions or questions.
May I speak?
Yes,
Hello
please.
to all. I'm Julien Komna Agbesi from Revoke, the West African NGO platform network based in Dakar, Senegal. I just want to greet you. It's my first participation in your sessions. Thank you so much. A question which is not linked to the thematic of to the topic of this session, but I just want to understand what is Ubuntu. What does it mean, and it is in which language? Have you got me?
Yes. Thank you so much. So Ubuntu is, it means, it's loosely translated as I am because you are. So basically, the reason why I'm in existence, basically we all have roles and to play in each other's lives, right? It's derived. It's a one of the Bantu languages. Yeah, that's what it means. I'm based in South Africa, so it's part of our, I would say, one of our local languages, Ubuntu. But it basically means, loosely translated, as I am because you are, which spills down to, we are all responsible for each other, something like that. I hope I'm able to loosely translate what that means. Yeah, I think so. Thank you for asking that question. So if we are to define it further, it's basically Ubuntu is basically it's a quality that includes the essential human virtues, compassion and humanity. Yeah, it's used by so many people to mean, so to express certain things, but basically it's, if we're to sum it down, I am because you are. Yeah, to loosely put it. Yeah. Okay. So I don't know if our moderator is still part of the call, but if we're not, I would like to ask the panelists just to say one word, in closing, before we close the session. So we'll take a round from Kazosi, Nora, Clive. Bruce is not part of the call anymore. Just to say one thing in closing, and then we close the session. Thank you so much, participants and colleagues, for joining this call. We apologize that we started late. We had a lot of technical challenges and glitches initially. Thank you so much. Kazosi, over to you if you can hear me.
Yes, Josephine, thank you so much. I just want to thank everyone who has participated in this call, and encourage the young advocates to go on, to keep pushing for what they believe in, because the environment will never be conducive unless we try our best and work within this environment, and be sure and be hopeful that one day we'll have what we are striving for. Just here in Uganda, in the lockdown, the recent lockdown that started on around 18th March 2020, there is a report of Heart of a Child. It's an organization here in Uganda that documented that more than 2,372 teenage pregnancies were registered within 4 months. This report was this data was documented around March and July. So the document, the report says that more than 2,372 teenage pregnancies were registered, and at least 128 of were married off in the districts of Chegwe, Gwara, Kai, Kamina, and Luwelo districts in Uganda, our local Uganda. So one of these things, the reasons why these numbers, these escalating numbers are alarming, is because of our inner way to reach out to these communities with this comprehensive sexuality education out. My request to young people who are on this call is that let us find a way, let us get into these spaces where our issues are being decided. And she has a fear of telling her mother or father that I'm pregnant, but she has a need of accessing these abortion services. Apart from you, the young people who are with them, likes of just been there have been there, but times are changing, So you who are there right now, let us try your best and use this opportunity to make the voices of such spaces that you have right now amplify the voices of these spaces. If you have an opportunity of getting into spaces that they can do, get into them and air out their issues. That's the only way that we are going to change my ideas. That's the only way that our voices are going to be recognized. I always say, nothing for us, without us. Thank you.
Thank you, Kazosi, for your contribution. Who's our next speaker? Nora, if you can hear me.
Thank you very much, Josephine. And I want to thank everyone that has been able to join us on this meeting. I think my parting shots would be, we are very many young people. Let's not sit and wait for us to be invited. I think, like Omar said, create these spaces for yourselves. And when you have the opportunity to be a part of a space, use it. I usually tell the young people that I interact with that it's very bad for you to be part of a session or part of a meeting and you go away from that meeting without saying a word, ask a question, leave that impression. But also I know COVID-19 has really left us with a lot of work. So let us make sure we have information, because as young people, we tend to speak to one another because we are peers. So let's try as much as we can to make sure we have the right information. Where you're not sure, refer them to someone with the right information. And I'm emphasizing that because we've also had very many young people that have done whatever they've done to themselves, or the wrong information that their peers were able to share. Yes, thank you very much.
Thank you, Nora. I see Bruce is back.
Yes, I am back. And sad that I could not follow up the ending of this conversation, but I'm here.
Bruce, we didn't get what you said. Can you hear me?
Yes, I can hear you. Just excited to, I believe we are reaching the end of our conversation today, and I don't know exactly what you were reflecting on before I came back on the call.
We were just making closing remarks from this panelist. So Okazose has made a closing remark, and Nora, I don't know if we still have other panelists. I know Clivert has been struggling to get through. I think, yeah.
I think that would be it. Nora, Kazosi, Rice, I see Rice is not here with us as well. And Clavier mentioned that he did indeed send his last remarks, that he and he shared a lot. Is there anyone else wishing to speak from the audience or the panelists? Okay, seeing none, Josephine, if you don't have any last comments, I think we could just go ahead and close off this meeting.
Okay.
But thank you. Yeah.
So I think on my side, basically, we had a speaker earlier on that was asking about Ubuntu, and I would want to relay or the whole aspect of Ubuntu, how it relates to the work that we do. It's just basically, like I said, the Ubuntu phrase, which is loosely translated, "I am because you are." It means, each and every person has a role to play in the next person's life. And bring it back to the work that we do, the work of gender equality, I think all of us have a role to play in each other's lives in terms of, availing opportunities, lifting each other up, etc. So I just wanted to tie it down back to the work that we do, that for us to achieve that gender equality, we all have each and every person has a role to play, so that we can have a gender equitable society. But thank you to the panelists for availing themselves to touch on the issue of the gag rule. We appreciate and we know that it has been repealed, and we're looking forward to working and recovering from the effects of the gag rule, the effects of the gag rule being in place. We're looking forward to recovering and working towards a gender equitable society. I think that's all from my side. I'll bring it back to you, Bruce.
Wonderful. Yes, indeed, it has been a fruitful conversation that we've had here today. I want to thank everyone, the panelists, and each one of you for participating in this fruitful conversation.